My name is Dr. Angela Nwankwo, and I graduated from the University of Missouri and Kansas City 6-year BAMD combined program. After that, I went on to complete my residency in physical medicine and rehabilitation at Baylor College of Medicine. Throughout my medical training, I've participated in numerous research projects, including but not limited to case reports, case series, systemic reviews, meta-analysis, and quality improvement and patient safety projects. So my primary areas of research are physical medicine and rehabilitation, including pain management, spinal cord injury, brain injury, electromyography for diagnosis, as well as any research pertaining to the musculoskeletal or neurologic systems. I've worked on and supervised case series, case reports, meta-analysis, systemic review, and quality improvement and patient safety projects. I've also done bench and clinical research too throughout my training. So I was named the Wiley Publication 2024 Most Reviewed Author. Based on my work, I've done numerous book chapters as well, published in Springer on the effects of anti-inflammatory diet for pain management. I'm proud of my work in identifying side effects for gabapentin, both typical and atypical. I think my research spans the breadth of pain medicine and rehabilitation medicine, and I'm proud of all the contributions I've made to medical evidence and patient practice. I've worked with many students that have been able to get conference stipends and presentation awards at conferences nationally, locally, and regionally. They've been able to get fellowships in the NIH and working with other large government organizations as well as private organizations. I've also had students that have went on to get their master's and PhD in research focused areas. So I think my unique approach to research mentorships includes identifying the student's strengths and using those to apply to the project. I think the best thing as a mentor to do is to be supportive, to be guiding, and to be encouraging. Research can be daunting and can be a lot of information to take in at first. So as a mentor, I tried my best to break everything down into bite-sized pieces that are tangible and useful for the student. That way they have a successful experience and they also learn to enjoy the research that they're participating in. I think my greatest strengths as a research mentor would be the diversity of projects I've participated in, as well as the breadth of knowledge I have in regards to approaching journals, publishing as an author in large journals, and just knowing what journals are looking for in regards to publication. I feel like all of those things are very important for having a successful research project, because it's one thing to conduct the study, but you also want your study to be recognized in some body of work. So it's important to have that in mind longitudinally as you're developing your project from start to finish, keeping in mind the questions that you're trying to answer, the population you're looking at, the data you're analyzing, and how you're writing your results and conclusion. All of these things really come together to determine whether or not your paper will be successfully accepted for publication. Ultimately, which is the goal that all students want. I know as a student that's something I always wanted, so keeping that in mind as you start a project is a big strength for me as a mentor. I would say I'm passionate about mentoring students in research just because I know how much research impacts the medical field. I've seen even papers that I've written be cited in patient conversations, in other journals and other publications. So the stuff we're writing about really is impactful and it really is bringing things to the cutting edge. I know it can be hard to think that a meta-analysis or systemic review of something that's already been talked about 1,000 times will not be helpful, but as new data comes out, it's always good to review the literature we have out there and make more active contributions to the science. So I feel like now that I know how impactful research is throughout my decade-long training, I love that I'm able to bring that passion to help students and also contribute in a meaningful way that will also help in their applications.